Because a child's brain, central nervous system, doubles in size during its first year of life and continues growing and developing at that rapid pace for the first 3 to 7 years of life, making sure this system is working at full function is simply the most important exam and assessment that any pediatric provider could ever perform for your kiddo. While traditional medicine relies primarily on symptoms, it looks for obvious pathology on standard exams like blood work, MRIs, and EEGs. Our practice uses an incredible piece of technology called the insight scans that accurately assess the function and health of the central nervous system. If your child struggled with colic and frequent crying as an infant, excessive tantrums and meltdowns as a toddler or preschool age child, motor coordination and speech delays, sensory processing and emotional regulation challenges, ADHD and anxiety type challenges later on, these are all signs that point to stressed out, tense, and stuck central nervous system. Sadly, most pediatricians dismiss most of these challenges as normal and tell parents still today things like, don't worry about it, they will grow out of it. Well, we now know that for most kids, those symptoms and conditions are obvious signs of trouble brewing in the nervous system. When we get into things like technology and neurology, many of us can get overwhelmed, confused, or disinterested quite quickly. But that's the beauty and practicality of our insight scanning technology that I really want to show you. It's super simple and easy to understand. So, who is this video specifically made for? Well, it's for the parents who are searching for an objective test that will show them what is really going on within their kiddo's nervous system. You will learn exactly what electromyography is used for and how pediatric chiropractic care can really help. First, let's go sciencey and talk all about the nervous system. The nervous system is a two-way street. One set of nerves are called sensory nerves that send information and report it to the brain and brainstem precisely what's going on inside the body, the internal environment, and outside the body, which is the external environment. The other set of nerves is more what is termed motor control nerves that send signals out from the brain and spinal cord and tell the various parts of the body what to do, when to do it, how to do it, etc. Because neurological communication with the nervous system has to do this vital, important job for 37.2 million cells in the human body, things need to happen fast and have absolutely clear lines of communication. We were designed to operate well past 5G, long before it was invented, and we certainly can't have our kids operating at dial-up speeds. This particular scan, called the EMG or electromyography, is vital for us to help our perfect storm kids best. It serves as the most important form of testing we can do when conditions like autism, sensory integration disorders, ADHD, and anxiety are being investigated. That's because each of these neurodevelopmental and neurosensory challenges are rooted in stuck tension, altered tone, and exhaustion of the neuromotor system. Most parents of a child on the spectrum who are struggles with sensory sensitivities are familiar with the word tone, having worked with outstanding professionals like pediatric PTs, OTs, and speech therapists. Neurological and tone challenges are a big deal, as motor function and development determine brain function and overall development. That means if the EMG scan detects patterns of stuck tension and imbalance, the brain is almost certainly stuck in sympathetic fight or flight tone and also struggling with an imbalance between its core functions of regulating emotions, behavior, learning, and even memory. These are the three common findings with pediatric EMG scans that we'll briefly describe them and show examples of each type below. The first one is raging bull. Now, this is a kiddo whose nervous system is stuck on the gas pedal and entirely in the sympathetic dominance mode, leading to challenges with such things such as hyperactivity, impulsivity, anxiety, difficulty sleeping, and so forth. Next is what we call the drunken bull. This scan finding most often correlates with a child struggling with coordination, focus, reading comprehension, communication, etc. Lastly, we have a raging bull that is also a drunken bull. This kiddo gets older, and when they often end up with both scan patterns and signs and symptoms of each. Now, the most exciting part about neurologically focused pediatric chiropractic care is that we can see changes in a child's EMG scans quickly because their nervous system is still learning to grow and adapt at a such fast pace. Their brains and bodies are growing and developing rapidly. It's quite incredible. But that also means that when subluxation gets into the neuromuscular system, as shown on the EMG, it can wreak havoc and alter the development for years to come. Diving a bit deeper into this particular scan, our Insight EMG scans also use a 3-step scoring system that allows us to really understand what's going on with that child's neuromotor system and thus overall brain and neural development. So here are the 3 scores you'll see on your child's EMG scan and a quick explanation of what they mean. First one is total energy score. This score tends to go way up in a child who's wound up and stuck in a sympathetic mode. And therefore, a high score here is most often seen with our raging bull cases, struggling with things like anxiety, behavior, sleep issues, and so forth. Next, we have our pattern score. This is a significant score to the overall neurological tone. And a low score here indicates a child who's really likely struggling with emotional dysregulation, focus, concentration challenges, postural exhaustion, and a weak core. Next, we have our symmetry score. This score measures the balance between the right and left sides of their neurospinal system, which is crucial to be sure that there is a balance in overall brain function and coordination. Now, the number one score that we look at that will tell us if a kiddo is a raging bull is the total energy. A normal score should be 100. When we see total energy get really high, that goes beyond 200, 300, we've even seen it as high as 800. That tells us that that kiddo is a raging bull and that their entire neuromotor system is fully locked into a fight or flight tone and interfering with their neural development, like standing, walking, sleeping, emotions, digestion, and even more. Sometimes we have seen it where the other 2 scores, the pattern and symmetry, are really, really low at the same time, leading to a kiddo who's raging and a drunken bull at the same time. Now, when we look at the drunken bull, a kiddo who's really struggling as a drunken bull, type of neurological challenges, their pattern score and symmetry score will be really low, anything below 60% and below, where we really want to see those numbers 80% and higher. When you have a kiddo that is a drunken bull, they will be really struggling with emotional regulation, sensory processing, motor coordination, digestion, and more. The Insight scans do exactly what they're named for. Give us insights and an understanding of the most crucial aspect of your child's health in ways that no other health practitioner can. Their nervous system truly is the mom of the entire body, keeping everything and everyone on track at all times. And just like in quite a few moms, they can get worn out. But it truly doesn't have to be that way. At Harmony, we will put together all our scans and create a personalized, customized care plan just for you. With each adjustment during that restoration or wellness care plan, you'll see the stuck stress and tension leave your kiddo's body and really create calm, relaxing, healing that comes within the inside. We can't wait for you to experience miracles that only neurologically focused chiropractic care can bring to the table.